Today is National Botox Day. National Botox Day. And so I thought it'd be a good idea to do a short video about Botox. I'm sure we all know a lot about Botox. Everybody knows a thing or two about Botox. So what I'm going to say today is probably not new to you at all, but I'm just aiming to add one or two things to what you already know about Botox. And so let's get right into it. So what is Botox? Botox is actually, the actual name for it is botulinum toxin. Botox is a trade name for botulinum toxin, which is actually the medicine, and it is a neurotoxin. It is produced by a bacterium called Clostridium botulinum and some related species of that. The main action of it is to prevent the release of a neurotransmitter called acetylcholine. This neurotransmitter makes connection between nerve endings and muscle cells to produce contraction. And so when Botox is used, the idea is to stop that signaling from happening in order to prevent the contraction from happening, so as to produce relaxation of the muscle. And why would you want to do that? You want to do that if the contraction of the muscle is producing an unwanted situation or symptom. And so Botox is used for that purpose. It is a protein and it is classified as an enzyme. It has uses in medicine as well as cosmetics. So I will just mention briefly some of the medical uses of Botox. So Botox medically is used to treat things like spasticity, which is an abnormal muscle tightness due to prolonged muscle contraction in the upper arm. It can be used to treat crossed eyes or strabismus, and severe underarm sweating or hyperhidrosis. It can be used to prevent migraines in people that have really troublesome migraines. It can be used to treat overactive bladder, to reduce stress and as well as incontinence. It can be used to treat eyelid spasms, otherwise known as blepharospasm. It can be used to treat cervical dystonia, a condition that affects the neck and the head and produces a lot of pain. Other uncommon uses, which research brought up, are alopecia, sialuria, which is excessive production of saliva, psoriasis, which is a skin condition. There is more to it than that, but generally it's a skin condition. An uncommon type of eczema that affects the palms of the hand and the soles of the feet. It is also used to treat anismus, which is a dysfunction of the anal muscle. It is used to treat vulvodynia. Vulvodynia is pain, is vaginal pain without any clear cause. It is used to treat Raynaud's disease, which of course is a circulatory problem. And echalacia, I'm not sure I'm pronouncing that right, but it's basically a throat problem that makes it difficult to swallow. So these are the uses, the medical uses for Botox. And of course, this doesn't cover everything. There are other things that I'm probably not aware of, and even of the ones that I'm aware of, some of them I've left out because the idea is not to do a comprehensive lecture on Botox. It's just to give a little bit more information. And then we come to the cosmetic uses, which is where, I use it. So primarily in aesthetics or cosmetics, Botox is used to reduce the appearance of wrinkles, particularly in the face. Now, the effect is temporary, which means it needs to be repeated after a period of time. Generally, it lasts for about 3 to 6 months, and according to research, sometimes up to 12 months, depending on what the treatment is for. So this may not be for aesthetic, purposes. And so, if you bear in mind what Botox does and how it works, you can see how it is that it can be used to treat, to reduce the appearance of wrinkles, because it reduces the contraction of the muscles that produce the wrinkles. So the usual sites for treatment here, let me introduce my assistant, Tracy. So this is Tracy, my assistant, and if you see, I have done mock markings on Tracy as if I'm actually going to do Botox treatment on her. So there are many areas where you can use Botox in aesthetics. So I have here between the eyebrow, which is the glabellar complex, or the frown lines, or the 11s, as it is sometimes called. And then around the eyes, or the crow's feet. So the muscle here is orbicularis oculi. Here you have the glabellar muscles. And also here, just at the top of the nose here, there's a muscle here called the procerus. So it's usually the one that causes the horizontal lines around the bridge of the nose here. So we also treat that to prevent those horizontal lines forming, because after a while they do become really deep. And so so that is that. And then the horizontal lines on horizontal creases on the forehead, which can become really deep. They start off as dynamic lines that form when we animate, and then over a period of time they can become really deep lines across the forehead. So this marking here, these are examples only, because we always have to assess our patient or client and decide where we will put the Botox injections. So this is almost like classic, apart from this tiny one here and this tiny one here. So sometimes we will put a little bit here and there just to help the eyebrow, to cause a little bit of a lift in the eyebrow. Okay, so those are general ones. There are many more areas to use Botox for in the face. So for example, here it can be used just around here, the upper lip area, to treat gummy smile, to reduce gummy smile. That's to reduce the amount of gum that shows when somebody smiles or laughs. So it can be used to treat gummy smile. And here in the the downturn mouth, so there is a muscle here that pulls down the corners of the mouth. So sometimes, if it is possible to just give a little bit of Botox just here or here to reduce that effect and cause the corners of the mouth to come up. Obviously, you also treat right at the spot where the corners are. And you can reverse that with fillers to bring that up and to reverse it upwards. But to prevent it happening too soon, you could actually happening again too soon, you could actually treat here with Botox. And then this little spot here. So sometimes when somebody smiles, you see like a cobblestone appearance right here in the chin. It's due to the contraction of the mentalis muscle, and so it can be treated with Botox just to relax that. Okay, and then also, so these are, a lot of these are off-label. They are off-label uses for Botox, even in aesthetics. Just to bear that in mind. I'm not saying you should do this. I'm just saying it is being done, and yeah, okay. And here, so I've put a little one here. So this is the master muscle. So it's basically, this is a muscle for mastication, for chewing. Sometimes they can become really bulky and give a square face appearance. And treating them with Botox can reduce the the appearance of the square face. And also sometimes the muscle is so tough and so tight that it causes grinding or bruxism, when somebody's not bruxism, bruxism, when people are sleeping, they can even be grinding their teeth in their sleep. So sometimes the masseters are treated to reduce that and to reduce tension around this area. I already mentioned with the medical uses about using it for Botox, which will be around the forehead. So I think that's all I'm going to say. Obviously there are other uses, but I'm not going to go into more of that because a lot of it, and a lot of the ones I've already mentioned, they are off-label uses. So the FDA approval is mainly for this area, to be used to treat this area. So that's the approval, the FDA approval. The rest of it is mainly off-label. So those are the common uses in aesthetics. And so yes, so Botox, like I said earlier, is a brand name. So there are other botulinum toxins in the market today. So for example, we have Dysport, and we have Xeomin, we have Myoblock, we have Juvo, and Azalo. Yeah, so there are a few more in the market now, and there are going to continue to be more in the market. So that is my little addition to the knowledge of Botox in the World Wide Web. Have a good rest of the day. Bye bye.